Fine. So today's the topic given to me is perception about supply chain and the best practices. You all are aware, best practices you all follow. I don't need to highlight much on that. The perception, yes, we need to talk about it, about supply chain. So it's my pleasure to be here with the SCM community. I feel proud that our community is growing and so talk about SCM in the market. So we are having frequent conclaves and this kind of webinar or this kind of conferences to discuss about SCM challenges, practices and how to improve it. So before going into our topic, I just wanted to give you some statistics about Indian healthcare. So how this Indian healthcare and where are we, what is our stand in the industry. Just wanted to give you some statistics. I believe may not be boring to you. These are all the segment in industry. Hospital sector gives 70% industry size. So if the industry size is 1 lakh crore, so 70,000, I'm just saying an example, so 70,000 crore is going to hospitals only. And pharma sector is 20% and the diagnostic and other insurance miscellaneous is 10%. So these are all the segments, so we all proud to be part of the major segment, hospital 70%. And this is a growth story. It's I believe growth trend. This last 2008 to 22, we have grown CAGR 16% growth. And in last 5 years, we have grown around 22%. So the expected growth and forecasted is in 2020 and 2022 is $372 billion size. So very big industry and it's still growing. So our size is very bigger than any other industry in the country. And potential of Indian healthcare sector, like do we have any idea about WHO standard? So how many beds to be there for some population ratio? Right, I'll tell you. See, in India we need additional 3 million beds by 2025. This is a survey done by Niti Aayog. How this 3 million beds is being calculated? So we need 3 beds for 1,000 population. Based on our population, 1,000 population, we need 3 beds. We need 2 nurses for 1,000 population. At least 1 doctor for 1,000 population. So accordingly, so we need 3 million beds by 2025. And India need 1.5 million doctors by 2025. We need more doctors and 2.4 million nurses required. So the way we grow, the way population is there, these are all global standard accordingly. So compared to US, UK and other countries, Europe, so we are far behind. So, and this life expectancy in India is currently 70 years by 2020. It was in 1990, 58 years. In the last 32 years, our life expectancy has increased by 22 years. Right? And then US and Japan is having Japan is the highest number, 85 years life expectancy. I believe you all are understanding this life expectancy. So the years people live in the country is average 85 years in Japan, US is 77. So we will reach by 2100 is 82 years. That's the assumption by survey says. So we have grown in last 30 years very high. So 58 years life expectancy becomes 70 years and there are a long way to go. Why I am saying you here is, this is only a supply chain forum, so why do we know this? So why I wanted to say is, we should know that what kind of industry we are and how much potential is there to grow. So there are huge potential in this, in the healthcare industry in India. And we are, the medical tourism, we are the top 6 in the world. So if you take top 6 countries, we are one of them in the medical tourism. Lot of countries sending their patients to India because of our quality of work, our doctor, our treatment, our price, all factored. So from 5 to 6 billion to $13 billion going to be by 2026. So the growth is 2 million patients from 78 countries. People are coming from 78 countries. 2 million patients coming to India for the treatment. So there are a lot of potential in the medical tourism side as well. So India is currently only 2,700 mammograms. This is just for your number. So less than 5% of mammogram available in the US. According to US population and our population, the mammography machine what we have is very less. We have only 5% of the machines compared to US, right? And the same way like PET CT, we have 120 PET CTs. 30% cancer centers have advanced imaging technologies. So we do not have many cancer centers doing only chemotherapy or some lighter version of the treatment, not going for the high-end treatments, and they don't have even high-end machines to treat the patients. This is the India pharma at glance. I think Robin will be interested to look at it. So this is statistics like the sales growth is 10.4% versus compared to last year 5.3%. So pharma industry grown in a very good manner. Volume growth 1.4% versus 1.5% last year. And this product launch, new product have been launched 2.2% versus last year 1.45%. So the pharma industry is growing in a very rapid space. And leading pharma therapies, these are all the major pharma therapies which contributes to 86% of pharma market. So the major is cardiac, 13% share, and your anti-infectives 12%, gastro is 12%. So these are all the share, and the growth MAT is monthly, average month moving annual total. Sorry. So the growth is there like 8% in cardiac, gastro is 10%, anti-diabetic 6%, vitamins increasing 5%. All doctors are writing vitamins, and respiratory, gynec is growing well, 20% in the growth. So the market share is 3% in gynec. So these are all the industry numbers, statistics. So just I am highlighting you these numbers for which industry we are, how we are performing, and where is in 5 years time or 10 years time where the industry will go. And these are all the emerging trends post COVID. Shifting from communicable disease to non-communicable diseases, must be noticing it. The communicable disease is less now except COVID. So COVID is still there, but here and there. I don't know how much it's going to impact in the future. The shift is a big one, like from communicable disease to non-communicable disease. Non-communicable disease of cardiovascular, your lung infective diseases, and your diabetes. Diabetes is a big one, growing very rapidly. By 2030, now we have around 45 million people are there as a diabetic people in India, and it may by 2030 it will be 90 million people get infected. So there are huge shift from the communicable disease to non-communicable disease post pandemic. This is what we are noticing in last 1.5 years. We are addressing that, lot of cardiac problems, lot of lung diseases coming. And expansion of healthcare facilities to tier 2, tier 3 cities, you all are aware. So most of the corporate hospitals moving towards tier 2, tier 3 cities. For example, like Jaipur, Lucknow, Kanpur, these kind of cities getting more hospitals. Most of the corporate hospitals moving towards that side to treat. Also, our AIMS, there are 6 AIMS hospital is going to start in the tier 2, tier 3 cities. So the healthcare is growing in a tremendous pace, and emergence of telemedicine, all are aware. The telemedication is started and moving fast, and adoption of artificial intelligence. you all are aware that like most of the surgery is done nowadays at robot. So we all have robot systems. Even we have ortho robots, spine robot, and there are many other way artificial intelligence helps for the better treatment to the patients, like your proton therapy, MR Linac, this kind of high-end machines coming. All are artificial intelligence based, and it gives accuracy, and for the treatment. And increasing penetration in healthcare, there are a lot of investments happening in the industry and rising healthcare tech startups. There are pre-COVID, there was around 2,000 companies were there, the startup company. Post-COVID, we have in India around 7,000 health tech companies started. So huge investment happening. There are around $20 million comes inside the country for this investment. Most of the focus by government and the private sector and startup companies focusing on healthcare side. Maybe the app like your pharmacy app or video consultation or treatment diagnostics, many kind of things. So focus on universal immunization program. India is the biggest country, manufactured many number of vaccines. COVID vaccine we have injected or produced and injected 240 crores, which is the highest number in the world. No one has manufactured this kind of high number of vaccines in India. Apart from that, number one vaccine manufacturer, except this COVID vaccine, our Serum Institute is the number one company to manufacture huge vaccines and sell across the world. And personal care at home care services are growing. So most of the companies started their own home care, and the other startups are there for treating the patient at home. Rise in medical tourism, as I told you earlier. Any question? Coming to that's all the statistics of healthcare. Now coming to our supply chain management process flow. How this supply chain is nothing but from the raw material to till consumer. How the material is being processed, produced and transported and shifted and coming to the patient or consumer's hand. That's all the supply chain process from the raw material to material size. These are the process flow for supply chain. You all are aware about it. So overall, supply chain's main motto and focus should be the customer experience. Our customer is doctor, our customer is the patient, our customer is the vendor. So all the stakeholders of the supply chain is our supply chain healthcare focus should be the patient orient, patient towards the patient experience better, and we should support the doctors as well as the management, aligned with the management goal. And this supply chain management in a hospital, you all are aware. I think I don't need to explain much about it. So the strategical technical inputs, there are 4 pillars of the supply chain in the hospital, and inventory management is a main pillar, and negotiation and purchases, and cost control, margin improvement, and payment management system. I believe these are all the main pillars of the supply chain in the hospital. So rest of the process, you all are aware how we are placing the order, how we get it, and it comes to receiving. These are all general standard process. And this is an interesting survey, maturity assessment of your supply chain function. So this is done by the PwC. PwC has done the survey of supply chain management. They have created 4 buckets, level 1, 2, 3, 4. And this supply chain is not pertaining only to healthcare, it is entire supply chain, maybe a transport, maybe any other manufacturing industry, pharma, everything included. This study has been done. So there are 17% of people in the level 1 bracket. So level 1 is nothing but absence of integrated plans. So they don't have a system, they don't have integrated plans, and they only focus day-to-day basis. So whatever comes, they don't know what this department doing, what this department. They don't have a communication, they don't have integrated system. they only play on the day-to-day basis requirement. There are level 2, 42% of the companies, 32% of the supply chain functions adopted this jointly managed. So mostly we are in the edge of closing this level 2. Level 2 people, like we work jointly, we take care of all the departments, the movement of material, the requirement and inventory management, storage, everything happened with the aligned within the hospital department or within the group of the hospitals. These are all happened. So 42% of our we are aligned towards. So level 3, 32% people, few of us in the level 3, few of us in the level 2 end stage. So level 2 end stage should move towards the level 3. So level 3 is incorporation of external input. So we have to get input from the doctors, input from the nurses, input. I'm just putting this as our hospital experiences into this, but this is basically overall industry practice. So we have to integrate the external users input to be taken, and accordingly you have to prepare your own hospital, pharmacy, supply chain or supply chains practices and process should be followed. And there are 9% people is extraordinary. They are doing everything perfect, integrated system, communication, all the things are fine. So only 9% of the people reach to level 4. I think we all should adopt those kind of new techniques and technologies to improve this kind of quality. And do you really think beyond the cost reduction? So SCM, we all think about cost reductions, reduce the cost, save cost, showing margin improvement. So beyond that, there are many things which we should notice it. This again, PwC has done this survey. So 61% of the people believes that it's cost savings, and 51% people compliance with the regulatory requirements. They also follow this, and 41% people says partners and suppliers expectations. 28% people is potential for revenue growth. 25% is customer experience, and 21% is ethically responsible. So beyond that, beyond the cost saving, only reduction of cost, the technique of negotiations, quality, ethical, responsible, and then patient care services. There are many things which we need to follow. These are the statistics by PwC has done the survey. Beyond cost savings, there are a lot of things to address. Yes, about the topic, perception about supply chain management. In the layman language, what anyone can suggest, what is perception of supply chain? Is it good or bad? Good? Nice. No, I'm saying we all are supply chain people. See, it's not perception about supply chain on the others, like hospital or doctor or the chairman or MD looking at us. So, हमारे बारे में क्या सोचते हैं? What they think about?
One of the most source for implementation.
Good. Then positive, negative. Sorry?
Positive.
Largely positive.
Largely positive. Okay. So there are many, people thinks differently, and perception is, you can't change their perception, but you have to try to show and keep transparency to, create that or change their perception about the malpractices. तो पैसा तो खाता ही होगा, पता नहीं कैसे है ये बंदा, ये लेके तो आ गया. You have to create that confidence. So it will take time. You have to place your SOPs process in place, and then you have to show a transparency. It's not only cost saving, it's ethically running the department is very important. In purchases always says, हमारा तो तलवार लटके रहती है, कोई भी कुछ भी बोल सकता है, right? So I used to say to my juniors, see, if there is 5 company comes with a different quotation, so we have to buy one. So हमें 500 तो ले नहीं सकता है. If I have to buy this chair, so we used to buy 5 quotations. We used to compare technically and then negotiate. We have to go by any one vendor, right? So the remaining 4 vendor will say something in the outside the market. So this is the situation in India. Like we have to change the perceptions. I'll just take you through about the perceptions. We have some. I have something in my mind about supply chain, how outside people think, and what I also just slightly try to understand. So this revenue contribution, this is a major revenue contributor in the hospital. In any hospitals, 25 to 30% revenues comes from your pharmacy, medical stores, consumables. As you all are aware. So it's a one third revenue comes from the pharmacy and consumables. So everybody look at it, it's a revenue generator, right? And cost reduction. Every time, whenever there is any cost saving or margin improvement, they look at you. How much you can reduce it? How much cost can be reduced? How much margin can be improved? What is the savings you are going to this year? So every year the targets are set, and people think that so this guy can reduce the cost, right? And low commitment to quality. Doctors का perception है ये quality के बारे में कुछ सोचते नहीं है, सस्ता मिल जाएगा लेके आ जाएगा ये. This is what the perception. I'm just putting it as frankly the doctor what believes. This is that ये gloves को बेकार है, ये A4 size paper भी इतना पतला है, और ये cost saving के लिए कुछ भी कर लेते हैं. That's a perception. And it's a major EBITDA contributor. So we give more than nearly 10% of cost reduction gives you 2% of EBITDA of the hospital. So major EBITDA comes from the pharmacy and consumables. So delay in delivering orders. So always doctors say surgery हो गया या सामान नहीं आता, बहुत delay है. So arrange नहीं कर पाते. Whatever you fulfill, some of the other doctor will say that नहीं सामान नहीं आता. Otherwise, if you have to increase your inventory to fulfill that, then management will say that you are a huge inventory. One side that they say huge inventory, one side they say saman nahi hai. So you have to balance it accordingly, right? These are the, and I have seen in many places poor technology. I've never seen any software says your physical stock and system stock matching. I've never seen in any company, any software, maybe 1 or 2 exceptional, your physical stock and your system stock never matches. So this is a poor technology that we have, you can say, or we have a poor management to have the stock matching by systems and physical. Some of the other day they say that return हुआ था 1 year system में minus नहीं हो रहा है, plus नहीं हो रहा है. So this is what we always talk about it. These are all the perception about supply chain. And yes, this is lack of transparency. I don't think in our team nobody is there like. So transparency, is slightly gray area. People doesn't open up their, transparency in the negotiation, pricing, which vendor. So they wanted to just keep it as a secret, and they don't want to tell, कैसे किया, किसे. And biasness, yes, people believe that ये उसी का ही vendor होगा, ये उसका चाचा होगा, उसका, right? So this is what the biasness is there. So why he is giving the order to him only? He's continued last 3 years, easy vendor with it. So these are the biasness which we should look into that. Lack of internal communications. Yes, we are very, very poor in communication. I admit that we all, work on day-to-day busyness in the day-to-day schedule. And we arrange the stocks, deliver, and see the margin, see the inventories. The communication is very important. We don't communicate what is not available with the doctor. We don't communicate to the nurses what is there, what is not there, what to indent, what not to indent, and which code you have to indent. Most of the problems, supply chains problems are with the communication. The problems are solved within the communication. Properly you communicate to the team, your internal customers, your problem can be solved. And poor supplier relationship. So mostly I would request everybody, I was also once upon a time I was like that, if you guys are in the purchase, but treat your supplier well, don't treat them as a, एक तो बोल के गया है कि आप तो हमें कुत्ता समझते हो, please don't do that. My humble request is that they are also a human being, whether you buy or don't buy, give the time, meet them on time. If you don't want to meet, say that I cannot meet, so upfront, don't उसको 10 बार आया, बाहर वेटिंग कर रहा है, 2 घंटा वेट किया, 3 घंटा वेट किया, हम अपने आप को समझते हैं कि हम बहुत बड़ा है कि बस वेट कर रहा है. That guy can buy 10 people like us. He's waiting. Their time is very important. So we should give respect to them, and we should, create the relationship. They will help you. At the time of COVID and all, they only helped us. So we always reached them, requested them. They have helped us. So I say Robin have helped in this, arranging this remdesivir, tocilizumab, right? So much. And I'm happy that we should create this relationship with the vendor. Don't treat as a वो आया वेटिंग करेगा 1 घंटे तक वेट मत करो किसी को, बोल दो आप क्या बिजी है नहीं यार कल आ जाओ परसों आ जाओ. That kind of you should have a relationship with the vendor. That's what I believe. So compliance, all know pharmacy licenses, narcotic license, trade license. So all these things. Apart from that, your NABH guidelines, medication management, and your JCI guidelines. These are all, giving you a booklet of compliance. You just follow that. This will give you a good change the perceptions. And law in ethics, as we have discussed in the transparency, like personal financial favors, past reputation, and this false rumors. These are all the creates low ethics in the department. I believe I have covered all the perception about our supply chain. I request you all, we have to work towards, the management should trust us. So they should blindly believe us, yes, this guy is good and he will do a good. So we have to create, we are the team, so we are the leaders, we have to create that kind of perception in the market, perception in the industry. So we should be very transparent. That creates, you have to have a proper SOP and process in place. So you follow that and you transparently say that this is my SOP, I am following this. That's all. So that's kind of system you have to create it. And key challenges in supply chain, as you all are aware, I don't want to talk on this much. Insufficient management of stock. I told you that you have to balance this inventory as well as the requirement. So both inaccurate inventory data. We have very the HIS is not right. Many of the companies sells these softwares, so always shows inaccuracy where plus minus inventory is not matching. So expiry and damages settlement from the companies. These are all the challenges. Like most of the pharma companies does, but most of the non-pharma companies or consumer company doesn't. It depends on how much volume you have with that, and how much relationship with the vendor. Based on that, you can just return. These are all the challenges. And manual process. I hope most of the hospital come out from the manual process right now. Follow the hospital and by the IT systems they have. And minimum absence of automation. We don't do automation. So I believe everybody have ROL system in place. Thank you. So I think we have to create this. We think about automation in the department. Mostly our time we should spend in the technology to improve the department instead of small negotiations or small wasting time. We should focus. What can I do better in the department? What can I do? New things. Create it. Any new software, new technology, new systems that will value add, and that will save your manpower. That will save your cost, and that will that data accuracy will be right. So you have to create it. Lack of storage space in any hospitals. Most of the hospitals keep the IV fluids and gloves outside the hospital or corridor. So this kind of that is compliance according to the Drug Act, so we should have that. Most of the hospital doesn't care about this space, and we say pharmacy bahar hi lagwa do, yahan lagwa do, wahan lagwa do. That's a standard practice which we need to change. Frequent change in the product line. Doctors prescribe, one of them, my friend was saying that doctors itna likhte hain, 12 brand, 13 brand humne rakhna pada hai. This is frequent changes in the product line. Doctors prescribe frequently changing the brand. You can cover it up by creating the formulary committee, and give the importance to the medical superintendent, call him and discuss, put up your problems to medical superintendent. So he will take it up, and you have to put him as a responsible. See, I can give only 2 brands, 3 brands. I cannot give more. This is a problem, you just discuss with the doctor, right? Use him, and then you can just reduce your problems. And price and currency fluctuation. So price is increasing heavily, and pharma as well as the non-pharma products. Most of the last year to this year, the price inflation is almost 7 to 8% has increased the cost. And every company is coming and asking us for price increase. Somehow we are managing, but it's there. Always this dollar fluctuation is there, like 84, 85 rupees now. So that also increases the cost. Getting good margin on MNC product is a challenge. Like the MNC brands, we always get 16 to 20% margin. We don't get high margin, so that's a challenge. And regulatory challenges, price capping of NPPA, DPCO grade. So you all are aware, like last December 19 there was one order, NPPA. January 6th there was another order. January 11th there another order. So you guys expect every week there will be order. So be ready for changing the MRP, reducing the MRP, and it is going to kill your margins. So it's a big loss to many of them. So most of the antibiotic is expected in the pipeline, so it will come in this year. So this 2023 will be a very challenging year for maintaining the margins. Whatever you have committed to your management, what margins you are going to give, it will be difficult to manage because of this DPCO and NPPA. And MNC companies are reducing product presence in India market. Like what we heard, there are many companies out from the country because of the NPPO, DPCO order, NPPO, DPCO order. Just like your, if meropenem comes into NPPA, I don't think Pfizer will continue with the original product. Like, so all the original product will be out. Like most of the product has been already out. Like your Perfalgad is out, and your Josin is out. Exidas is out. So there are plenty of product is out because of NPPA and DPCO. So this will give less confidence in getting the quality product. Like when we believe that research brand will have some kind of value, so that will have some impact. So identify your potential risk in your supply chain. The risk is, this is also again survey done by PwC. So what are all the risks in your supply chain domain? They say material price fluctuation is 53% risk. हमारे लिए what we believe, how this how I am going to maintain the margin, how I am going to maintain the revenues and all. So the price fluctuation is 53% people say this is the biggest risk. And then currency fluctuation is 47%, and then material charges is 41% changes, sorry. Energy, fuel price, and there are many other transport and counterfeiting, others, cyber attacks. Even cyber attacks, 2%. You know that last time AIMS got a cyber attack. Even many other companies got cyber attack, and they climb a huge amount. So there is a dark web, so they climb 70-80 crores for giving back the data. So that kind of hack is happening. So be secure. Cyber attack is going to be a big risk in future. And best practices, you all are aware, like cost reduction and negotiation, inventory storage, and digital transformation for supply chain, sustainable supply chain. This is called CID. CID is cost and inventory and digital is going to be the future. And I don't want to boring you with the old standard thing, but just I would like to read it out so that you can just recollect your practices. Cost reduction and negotiations, consolidation of suppliers. I think most of the companies are doing consolidation of suppliers. By that you can just increase some more few margins. Control of supplies, return will be easy, and there are help during the pandemic times, or they will support you in terms of during pandemic and all. So you have to create supplier consolidation, and then it will help you to get consolidated everything. Thorough due diligence on vendor selection basis, regulatory adherence, sustainability and scalability. So before hiring any vendor, do a thorough due diligence, whether he is qualified, licenses he has, how he is delivering, and what about other hospitals where and all he is supplying. So these kind of inquiry you have to do, and then you can just take it forward. Contract must have mutual interest components for both parties related to pricing, hidden cost and payment terms. So most of the time contracts we made or we prepare only for one sided. So सब कुछ हमारे लिए benefit होना चाहिए, vendor को squeeze करो. So that will not going to work out for you for a long time. Long term के लिए you have to create both parties win-win. You have to give something, you have to take something. It's not that one sided. You squeeze the price or you squeeze the terms and conditions, then you are not going to get any continuous business. So it may impact on your continuity of business. So don't. My advice is that don't squeeze much to show that I am getting a best price, but that will not for long last. And then eliminate maverick spending. There are a lot of duplicacy and a lot of unwanted spending in the supply chain department. So you have to identify and eliminate that. And run an outlier analysis. There are a lot of analysis available. You guys are expert in that. And must be ready with the preferred product and supplier. So always you have to have in your formulary preferred product and suppliers, which are all the suppliers or manufacturers who you are wanting to work. Must have a business continuity plan for any catastrophic event and align functional goal with organizational goal. So your goal should align with the organizational goal. So as I told you, so the budgeting exercise is started I think in this month. Every hospital will plan for the revenue increase and budgeting they do exercise. So during that time your presence will be very important, because you are 30% stakeholder of the hospital. So your participation in the budget exercise is very important. So according to the hospital's revenue growth, you also have to plan your revenue growth, considering the NPP and DPCO impact, and considering the MRP increases. So you can project your department's revenue as well as the cost savings. So these are all on cost reduction on biomedical engineering, like avoid storage of expensive spares and go for CMC of equipment instead of AMC. So most of the equipments, movable equipment, you should get CMC. Non-movable, you can just decide whether you need AMC or CMC. And have a good preventive maintenance. Most of the time we sign a CMC contract with the vendor. The vendor doesn't come for the preventive check. When we have a CMC contract, so yearly 4 visits he has to do. So whether it is problem or not problem, so he has to visit, service the equipment, and then go quarterly once. But most of the company never comes, and we also don't realize that he has to come and do it. So these are all the things which you can ensure it. And keep a penalty clause on the AMC CMC for 98% uptime. So the machine uptime should be 98%. If there is a less 98%, you can go for some penalty clause, so that the company will be active to keep the machine up and running. So these is all inventory storage, inventory management, like categorize your inventory in ABC analysis, FSN analysis, and then many analysis available, slow moving, fast moving and all. So just look into that, all these things. Establish your inventory KPIs, robot measurement system in place. and then regulatory reorder trigger points. So you have to review the reorder trigger point in maybe 6 months once. So what we do is usually we put up reorder level. We don't review it on monthly or yearly or quarterly because we are busy, and once 5 years back we have put up the reorder level and it continues automatically. So we should review that because it's a seasonal change. It is a during the disease change. So you have to reset the reorder level maybe 6 months once, at least, or yearly once. You should review the reorder level and set it. And you can use it for RFID and barcoding system for IPD, UPD pharmacies and as well as the consumable stores. You can issue the items, right item at right time and right batch will be issued. So this last November 19, there was an order by the government for barcoding. So the government have told to all, mostly the pharma companies, the 300 molecule, 300 brand is going to be barcoded by the manufacturer. They will barcode it and they will issue to you, which is effective from 1st August 2023. They are going to implement it. Thus 300 drug is 30% of your pharma industry. So that they have covered it the first phase. After that, then second phase, third phase, they will go, and the barcoding system is going to be implemented across the country. So what the government wanted to understand or capture the movement of the drug from the manufacturing till the patient where we have issued. So that's what the idea of putting this barcode. Government is insisting manufacturer to put barcode on that. And these Kanban systems, you all are aware, like a 5S model. So again, this inventory management standardization. The rate contract, annual rate contract, you should have annual rate contract for your, most of the 90-95% of the items should have annual rate contract, having formulary for drugs and consumable both. So, reducing number of brands, you should have very minimum number of brands in your formulary, standardization of item master. So we have 12 to 15 days inventory in the OPD pharmacy and 30 days inventory in the hospital pharmacy inside IP pharmacy. Sorry, IPD 15, OPD 20, 30. All retail pharmacy having 30 days inventory. And this is digital transformation. So most of the companies adopting digital system in place. Cross-functional system integration, E2E integrated, all e-commerce coming. Every hospital is focused on the digital process increase. Automation of manual process to be automated. This sort of digital information is a very important function in the supply chain. You all think through what can be done in our department, what process can be put into the system. System can take through. So our headache, our work can be reduced. You can create the dashboard. You can create the automation of inventory monitoring daily basis, hourly basis. That kind of system you can use it. I think ever-changing environment, that's all, I believe. Thank you. So, mind, anything, can be done if your mind is changing. Your mind should change. You should ready to, accept the change. So then this is possible, whatever we are discussing. So, thank you very much for patiently listening.